So the ARIEL3 trial was a randomized phase 3 study looking at Rucaparib, which is one of the PARP inhibitors, in the maintenance setting in women with platinum-sensitive recurrent ovarian cancer. So patients who responded to platinum-based chemotherapy, a complete or partial response and normalization of CA125, were then randomized to either maintenance Rucaparib 600 milligrams twice daily until progression, or placebo. It was a study that included patients with BRCA mutations and also patients who were BRCA wild type. The design of the study was by nested cohorts, so that the first analysis of investigator-led progression-free survival was done in patients that had tumor BRCA, so either a somatic or germline BRCA mutation. And if that showed a positive value, the next cohort, which included those patients, plus a group of patients who were felt to have the HRD, homologous recombination deficient phenotype. And that was determined by using an assay developed by Foundation Medicine that looked at the degree of genomic scarring through the loss of heterozygosity. And so tumors that had high LOH scores were felt to be more likely to be HR deficient, and so were included in that second cohort. And if that cohort was positive, then an all-comer analysis was done, an intention to treat analysis, which included, of course, the BRCA wild-type patients and those that were LOH negative. So what the trial showed was that in the patients with a BRCA mutation, somatic or germline, there was a highly significant improvement in the progression-free survival with maintenance Rucaparib compared to placebo. That difference in terms of medians was a 11.2-month difference in the median time to progression, which is clinically very significant. And when we looked at the LOH group included with BRCA wild type, that also was significant, as indeed was the all-comers. So in summary, the trial showed that all patients with platinum-sensitive high-grade serous ovarian cancer responded to Rucaparib maintenance therapy and had significant prolongation in their progression-free survival. When we looked using an exploratory analysis at the patients who were LOH high versus LOH low, these are BRCA wild type patients, we saw the effect of Rucaparib was positive in both those groups. So what that told us was that unfortunately the LOH test isn't able to distinguish patients who will respond and those who won't respond. So I think more work is needed to try and identify the cohorts of patients who benefit less from these treatments. But the magnitude of benefit was greatest in the patients who had a BRCA mutation. In terms of side effects, I mean, quite a lot was known about Rucaparib because of the earlier studies, the ARIEL2 study, and really the side effect profile was very similar to the profile that had been seen in those other types of studies, with fatigue, nausea, altered taste being the main side effects. Most of those were of low grade. There were not many grade 3 or above. Transaminase is something that people talk about a lot, elevation of transaminase with Rucaparib. We saw that in quite a large number of patients, but it occurs early and it's usually transient, sometimes needing a dose reduction, but in the main it's a very manageable side effect. Similarly, anemia is in the main manageable, and we didn't see any thrombocytopenia. One of the things that's very important about Rucaparib and indeed the other PARP inhibitors is whether patients can tolerate these drugs for a long term. So we talk about side effects that are reported by patients, but one of the other parameters is how many patients stop taking treatment because they don't like the side effects, and that was around about 13%, which is really in keeping with all the other PARP inhibitors. So most of the patients will continue on the PARP inhibitors. Sometimes you have to reduce the dose or even give a dose interruption, and indeed that was the case in about half of the patients that they needed a dose reduction. But again, that's something that we've seen with other PARP inhibitors too. This is flat dosing, so you have to tailor the dose of the drug to the individual patient. But overall, I think what we can conclude is that Rucaparib maintenance therapy produces a significant improvement in progression-free survival in women with platinum-sensitive relapsed ovarian cancer.